Hello, welcome back to our podcast, Hypermobility Haven, with me, Amanda Carey.
And me, Holly Graham.
Both final year BSc physiotherapy students at the University of Brighton.
As we have previously mentioned, none of the information you'll hear in this podcast is professional advice, more just ideas and what we've learned about these conditions as student physiotherapists. If you want any further information about anything we have discussed, please contact your GP or your primary caregiver.
So we thought we'd start by talking about the triad between EDS, MCAS and POTS, because those three things link together. In our last podcast, we talked about differentiating EDS from HSD and how the new parameters have changed since 2017. So now it's come to sort of talking about the comorbidities and the different features of the connective tissue disorders. So the first one we thought we would just recap is talking about EDS, which, as we talked about before, is a collagen or has collagen issues, the main feature where the endothelium is not as strong and prone to micro tears. And then with this damage, there's an increased risk with toxic insults, viral infections and so on, which results in dysregulation. And this basically causes MCAS, which is mast cell activation syndrome. So in EDS, where the endothelium is damaged, it's unable to regulate, and that can cause the vascular system to collapse. Mast cell activation syndrome is an immune dysfunction caused by abnormal mast cells or abnormal release of chemicals contained within them, according to potsuk.org. Mast cells are the drivers of immune system protection, and therefore MCAS specifically affects the gut, skin and endothelium, and also causes or is linked to dysautonomia and POTS.
So does MCAS just affect EDS, or is it hypermobility too, or do you know what I mean? What conditions also would you say are more likely to develop MCAS?
I think the triad is meant to be specifically with, obviously, it's going to be EDS in general because it's about the immune dysfunction, but because of the endothelium, which is made up of collagen, and that regulates our vascular system, obviously in hypermobility EDS, then that's going to obviously have a much more sort of negative impact in that situation. And also there's a link between, obviously with the histamine itself, histamine can trigger allergic reactions. So a lot of people who suffer with MCAS or have EDS or other hypermobility spectrum disorders can experience a lot of allergies.
Right, okay.
And that can be triggered as well, has been shown in recent years with COVID, long COVID. So people have developed big reactions since then. So recognising MCAS can be quite difficult. So usually the advice is following an episode featuring, all these different symptoms. Then, they might test for your mast cells directly following an episode, looking at the chemicals found in the blood or in the urine following an episode in particular. People, you might also get asked questions about when did you last feel well, for example. It could be that you've had a reaction to dust or mould, for example.
All right, okay.
Which we live in Brighton and there's lots of mouldy
I was
properties.
Say, that's a sign
I know,
to deep clean
exactly.
My house.
Yep. So I did actually meet someone the other day, and he said that he'd had long COVID and he used to be a dentist, and that one day he went back to his dental practice after having long COVID and he collapsed.
Oh wow.
And that they told him he could never do that job because it would kill him. So I wondered whether or not he actually had MCAS as a result of long COVID. So it was a very interesting conversation as we were about to film this podcast, and I thought, wow, that's a really good example of someone who's developed like an extreme reaction. And I met him because he's now a window surveyor. So he's completely changed his profession as a result of that. So the treatment for MCAS is very complex, obviously. You have to address the limbic system, also looking at toxic load, mold, infections and so on to identify what it could be. And also trauma management is one of the treatments. And if you think about it, trauma is a sort of nervous system reaction, and that connects back to the connective tissue.
Yes.
which is why it's so predominant in people who have connective tissue disorders. So the other thing to point out, really, just to summarise really about MCAS, is high histamine foods, which are often considered, very sort of healthy foods normally, such as bone broth, for example, vinegar and spinach, are actually triggers for MCAS. So in that case, they wouldn't be considered to be healthy options.
Yes.
So don't always go with whatever you assume for one person as a healthy option.
Don't always go to the supermarket and pick the greenest thing you can find.
No, exactly. And also that's why triggers such as heat, cold can be quite predominant in people who have hypermobility disorders and so on, because again, that's a trigger for MCAS. Toxic load, as I've said, and all these things can result in blood pooling in the peripheral system, which trigger a drop in blood pressure and an increase in heart rate to compensate to maintain the blood volume. And this results in POTS, or postural orthostatic tachycardia syndrome, which we're going to talk about next. And that basically means that when someone stands up, blood can't get to the brain because the system is collapsing. That's what happens in MCAS specifically. But there's lots of different types of POTS, which we'll go into shortly. But first, let's talk about brain fog.
Yes. So brain fog is quite difficult to kind of pinpoint exactly what it is, I find, because it varies for different people. People tend to struggle doing daily tasks, things that you would do without thinking. They almost forget what they're doing or how to do it. Mm-hmm. So this can present differently for many different people. So someone might, for example, forget how to make their lunch, forget how to make a sandwich, or someone else might forget what the conversation's about and completely become disorientated in what's going on.
So there's issues processing information, and it can be short-term and long-term.
So there's many things can cause brain fog. So there could be autoimmune conditions, so things such as lupus, multiple sclerosis or MS, fibromyalgia. It could be neurological conditions, so dementia or a brain injury. Infections, so things like COVID-19 and long COVID, which is one of the newer long-term chronic conditions. Low blood sugar levels, vitamin deficiencies, sleep deprivation, poor diet, stress, mental health. Well, there's a whole variety of different things that could cause brain fog. So it's, I'd say, relatively common amongst chronic connective tissue disorders that we've been discussing.
Particularly as we are talking about, always going back to the stress bucket.
Yes.
So adding more and more of these things into the stress bucket then increase the likelihood of you getting brain fog.
Yes, because it adds all of these stresses to your life, and then you struggle to concentrate and think clearly because there's all of these other millions of things running around your head, fogging up what you're doing.
Yeah, and also it can affect problem-solving skills, as well as coordination and proprioception. And proprioception is another thing that's affected specifically in hypermobility anyway, so it's kind of amplifying that feature of the condition. So some of these features overlap, and it's not necessarily that one has caused the other. We're not really sure, and maybe that's not the priority. It's kind of working that out, because you'll just go round and round in circles, and you'll probably get even more brain fogged if you try and work that one out. But it's more about trying to reduce, I suppose, the amount of overload. So that could be the cognitive overload with brain fog, or it could be the toxic overload if we're talking about MCAS.
Yes, and especially people can feel very overwhelmed by everyday tasks that if they didn't have brain fog, they might not struggle with. So there's simple things that people could do in everyday life, preferably when you don't have brain fog would be a helpful way to start this. But so having things such as post-it notes around the house saying what you need to do or what you have done, or having a flare-up plan and having a safety meal, for example. I know we spoke to Jo and they mentioned having a tomato soup in the cupboard at all times. So there's just a backup meal that you can always do on default when you have brain fog and it is affecting these things. You can still look after yourself and cater for your basic needs.
Yeah, that's the great ideas. And also one of the other aspects of brain fog is the inability to make decisions. So it could also be that that indecisiveness. Yeah, you might not feed yourself, for example. That could be another reason. So having those things just there in front of you as a backup meal kind of takes away all of that thought process.
Yeah, it gets rid of the almost out of sight, out of mind concepts.
And so when we are then thinking about POTS, which is the other part of this triad between EDS or connective tissue disorders, MCAS and POTS, we're looking at blood circulation specifically. So POTS is a form of dysautonomia, which is basically a disorder of the autonomic nervous system. So some of the features of POTS, the key thing that people kind of have symptoms for are dizziness, lightheadedness, and vasovasal syncope is common, which is basically where you feel like you're going to pass out, but you don't actually. And it's very rare. It would be very rare. We've been reading to actually lose consciousness if it was down to POTS.
Yeah, I've actually heard about a study to do with this on the Bendy Bodies podcast. I can't remember off the top of my head what episode it was in, but they were mentioning about how there was a study that did a 30-minute tilt table test, which we'll talk about in a minute, and there was a control group of healthy individuals and there was an intervention group which had individuals who had POTS in it, and actually more of those who had POTS didn't pass out, but they felt rubbish for the whole 30 minutes than those who didn't have POTS. So more of the healthy control group actually fainted throughout this test than those who have POTS. So as much as before we'd done all of this research, I thought with POTS you always fainted, but it might not be that. It might be more the feeling of fainting.
Yeah.
Which
but obviously being on there for how many minutes did you say?
It was
it half an
30
hour?
minutes, yeah.
I think I remember that, and I think it was the episode 125, the strategies for POTS relief. I think it was that episode.
It might have been.
With Satish Raj, who's the lead investigator for the Big POTS survey. I'm pretty sure I remember he was the one that said that, and how horrible it would be to actually be attached for half an hour
to the
tilt table without actually passing out. Yeah, so there's various sort of pathophysiological mechanisms which cause, or by which POTS happens, but it is very difficult because of that to determine a single cause.
Yeah, no, definitely. And POTS is diagnosed using this tilt table test. So the way that the diagnostic test works is you're secured on the table whilst lying horizontally, whilst lying flat, and then the table is raised to an almost upright position. And whilst this test is going on, your heart rate, blood pressure, your blood flow of oxygen and the exhaled carbon dioxide are measured. And if your body produces an abnormal heart rate when you're upright, your symptoms worsen when you're upright. Orthostatic hypertension, which is where you have a significant drop in your systolic blood pressure. So that means the top number drops more than normally around 20. You're considered to have POTS.
So can you talk to me a bit more, Holly, about the different types of POTS? Because I think there's a few different categories, aren't there?
There is. So POTS tends to be subtyped into 3 different groups. You're going to have to help me say this. Hyperandrogenic?
Yep.
Hyperandrogenic POTS, hypervolemic POTS, and neuropathic POTS. So hyperandrogenic POTS tends to be between 30 to 60% of the POTS population, and they have high levels of blood norepinephrine, and that is the hormone in your body that affects your fight or flight response, your blood pressure, your heart rate, your brain functioning, or it could affect your mood. And on standing, they have a high or fluctuating blood pressure, so when they're upright, they experience heart palpitations, anxiety, they might have a tremor, cold or sweaty hands and feet. And also in a large proportion of these individuals, there is a significant urge to pass urine or go to the toilet whenever they're upright for a period of time. It might be a short period of time, it might be a long period of time, again, it depends on the individual. But this is believed to be caused by, I'm just going to say, a hormone transporter deficiency, because I can't pronounce the hormone,
Norepinephrine.
Thank you. There also may be an abnormality in a gene that is leading to this norepinephrine in the body. So basically, with this, they're trying to find where is the sweet spot in the middle, because Amanda and I have actually just had a conversation about this, of saying it makes no sense, because if you have too much, you have symptoms. If you don't have enough, you have symptoms. So it's trying to find the sweet spot in the middle where individuals don't struggle with this tachycardia or high blood pressure when they're standing upright.
And also anxiety is linked to both too much and too little. I had to do a double take when I was reading and listening to the podcast, and I was reading some articles, and I was thinking, have I misunderstood that? And I had to go back and look into it a bit more depth. So if you have low norepinephrine, it can lead to various health conditions, including anxiety, depression, ADHD, headaches, memory problems, sleep problems. Sound familiar from all the other things we've been talking about? Low blood pressure, low blood sugar, changes in blood pressure and heart rate. But equally, you can have some of those symptoms, if not all of those symptoms, if you actually have high norepinephrine levels. So, yeah, it's definitely finding the sweet spot, as you say. And I think, it definitely requires a lot of investigation depending on the different types of POTS, because you mentioned hyperadrenergic, and what are the other
So we have
categories?
Hypervolemic POTS, which is where individuals have low sodium expelled through their urine. So this could indicate a low blood volume. So this could also be occurred by things such as gut problems, such as diarrhea or feeling sick and vomiting. This type, so hypervolemic POTS, basically means that they have a low blood volume and they want to work on increasing this blood volume to try and manage their POTS. And the final type of POTS is neuropathic POTS. The nerves that form up the autonomic nervous system in the hands or feet don't always work properly, resulting in widening of the blood vessels, which creates tachycardia. This leads to blood pooling in the stomach or pelvis, or it could be in the hands or feet. And there also may be a loss of sweating. There might be an autoimmune abnormality in neuropathic POTS. So neuropathic POTS might actually be more of an autonomic issue.
Yeah, and I was reading that actually they're not necessarily mutually exclusive. So you can get neuropathic POTS in particular, as well as having hyperadrenergic POTS, or you could have actually said adrenal if you found that difficult to pronounce, because it's the same thing. Yeah. Because it's an issue with or a dysfunction of the adrenal response, because it involves an overactive stress response system. And then obviously the neuropathic POTS involves nerve damage. So those things can occur at the same time.
So if you like to think of, I like a nice visual representation. So all the three different types of POTS are almost like a Venn diagram. So they can overlap. You might have just one type of POTS, or you might have two types, or you might have all three of them. And it varies from person to person and what they present with and how their symptoms manifest.
And I suppose it's because of the whole nature of the sympathetic response. That's why it can occur or co-occur, and why we got confused about norepinephrine, because it regulates blood vessel constriction. So in one instance, if it's too much, there'll be a sympathetic response, and vice versa. So that's why they have an overlap between them.
Yeah, absolutely. That makes a lot more sense.
So we also, in the Bendy Bodies episode that we mentioned, Dr. Raj also mentioned that there could be a series of structural causes or features of POTS. Notably, he sort of mentions craniocervical instability. You know, you can actually see bones that slide, he was saying, sort of on an X-ray, so it's not, you know, it is extreme, can be extremely unstable. But he also says that even though it can be extremely unstable, and obviously people might need to wear braces and so on if they're, you know, driving in a car, they might be concerned about their safety around their neck area, as well as obviously other musculoskeletal issues that come along with that. He sort of said that, you know, mild cases can be improved with physical therapy, and in extreme cases some people might opt for neurosurgery, But really the key takeaway from that is that he says, try and think about if you were to try and stabilise any of those symptoms through a particular treatment, would it actually change the symptoms that you're experiencing? Because if it's not going to directly impact the symptom that you're concerned about, then maybe it's not necessarily the first line of treatment to go to neurosurgery, for example. And he also mentions that even with different medications, some of them, like drugs such as methyl dopa, he sort of mentioned, which can decrease sympathetic outflow. He really says sort of this doesn't work for everyone and is really not the first line of treatment to go to a medication. So again, it's about supported self-management.
Yeah, definitely. Attempting the non-pharmacological treatment techniques would be most people's, I assume, first point of call, as you're not taking medications or undergoing surgeries or things. So I've got 3 non-pharmacological, and then, as Amanda just mentioned, about medications that can be taken to help symptoms of POTS. The interventions that I've looked into are drinking more water and increasing sodium load, so that will help increase blood volume. Exercise and compression are the 3 main subtopics, we'll call them, that I've looked into.
So how much water? I mean, I think I heard around 3 litres a day.
Yeah, that's about what I've heard as well, so
yeah,
it's around there, yes.
And I believe Dr. Raj, and then I looked at some more research on the topic, it was about 10 grams of salt. I believe.
Which I believe is roughly 2 teaspoons.
Yeah, but then obviously you're saying the difficulty in the size of, because not everyone has an actual teaspoon measure that's very accurate, and you'd have to just make sure that you're aware of not having too much salt, but also if you are on any heart medication or anything like that, then obviously you'd need to consult your primary care provider about that. But these are just kind of general advice that he was sort of suggesting. And also you mentioned about exercise. So the main sort of thing I was reading about that was that you have to kind of do a very gradual loading.
Yes, so from what I've read is that, so the heart is a muscle, we know that. So the more, it's like any other muscle, the more you exercise your heart, the bigger and stronger it will become. So yes, this means starting exercising from a really slow pace and then gradually over time building it up. It will not get better overnight. It's probably one of the longest intervention techniques as in terms of getting it to work, noticing the difference. So seated exercise or things such as swimming or using a recumbent bike or using a rowing machine are recommended for those with POTS, because you're not standing up. Some might be sitting up, some you could do lying if need be. It depends on the severity of the POTS, but it's best to start with little to no resistance and building up for duration, so building up to say around half an hour, and then starting to add maybe a little bit of resistance or a little bit of load to that gradually over time, as half an hour will help bring back activities of daily living. So it might help you can go on a little bit of a walk and you'll feel better. Your POTS symptoms might not be as prevalent. That's, to me, would be more important than I can lift this really heavy thing up off the floor, but that's me wiped out for the next few hours. I think making it a bit more sustainable.
I think it's trying to sort of get away from the idea that all exercise has to be done vertically or has to be painful, or have you have to sort of add a large amount of load in a very short space of time. So it really is kind of emphasising that the key to success is to keep the load very low and to have a sort of rest day sort of every other day, he was kind of suggesting.
Yeah, to keep moving.
And then it could take 4 to 6 weeks or so to even start to notice an improvement due to sort of post-exertion malaise. We were talking earlier about the exercise tolerance is low as well in people with POTS and also people with hypermobility, EDS and other hypermobility syndromes. So that's going to be even more important that you consider that it will take some time.
No, yeah, definitely. It's also about trying to get out of the mindset that not all exercise means you have to do 3 lots of 10 reps, like 10 repetitions. You don't need to do that. Like we said, going for a walk or doing some exercises, not vertically, horizontally, or doing some exercise in a chair, it's still exercise. It's still getting your body moving a little bit. And again, as long as it keeps, the blood pumping around your body, it keeps your heart going, that's what's important, because like I said before, the heart's a muscle. So when your heart is stronger, it's able to squeeze more blood out of the left ventricle, which is called your stroke volume. And your stroke volume works with your heart rate. So when you have POTS, your heart rate rapidly increases. But if this is to compensate for the low blood volume that's normally getting squeezed out of the heart. So if the heart is stronger, it's able to force more out of it in one go. Therefore, it should start to balance out the tachycardia, a little bit of the increased heart rate.
Good.
A little bit sciencey there.
It is, indeed. And also thinking about with hypermobility, before you start something new, Raj suggests testing whether the shoulders or hips are kind of able to tolerate that movement. So I would suggest, maybe thinking about more of a postural kind of training to start with, just to improve your proprioception, so you're aware of your alignment, your technique, and so on as well, because obviously because you're more prone to subluxing or dislocating certain joints.
Yes. Would always recommend trying something out before you go and purchase all of the equipment.
Definitely. And of course the stress bucket again, thinking what time of day is best to do the exercise, whether you should actually start it yet. Are you about to start a new job or a new course? Maybe it's not the right time to also add this in. You could start by maybe doing a bit of relaxation and focusing on tuning into your breath, that kind of thing. That could probably be started at any point, really, particularly if you do need a bit more time to relax because you are starting something else that's quite stressful.
That might be beneficial in a stressful situation.
It would be, but I certainly wouldn't then add in the actual exercises themselves just yet until you're ready to reduce all of that other overload.
Especially if it's your first time trying it, you might feel tired, you might feel fatigued the next day, you might be a little bit sore from the exercise dependent on what you're doing. So having time where it's okay to have just have a day where you might not be feeling your best, where you've got to evaluate, okay, what was good about that, what was bad about that, so on. Because if you're in a busy period, so for example for us it's coming up to dissertation period, it wouldn't be the right time to start the exercise program. Maybe over the summer when you've got nothing to do, or something a bit more like that would be a lot more beneficial.
Great. And the other thing you mentioned was the compression garments, which is again to do with increasing, managing the squeezing of the blood. So you're aiming to primarily squeeze the abdomen or pelvis. That's what Dr. Raj suggests. He reports that only 10% of fluid moves down to the calf muscles. So whilst it might seem easy enough to get some stockings, compression stockings, he's actually suggested high-end running garments or cycling shorts, which primarily squeeze the abdomen and pelvis, are actually a lot better, because as you stand, obviously the fluid in the chest shifts down, and then this can actually help with that blood flow, that circulation. Especially
with the blood pooling around the pelvis that we've previously spoken about, it will help shift that back towards the heart a bit more and stop it from all pooling there.
Brilliant. So we had so much to talk about, and we have talked about so much, and somehow we've managed to get through that in a much shorter space of time than I was thinking. But we thought we might just recap again. So obviously going back to the triad, just about so far what we've talked about. People with EDS have a proneness to collagen vascular issues, and also people with MCAS and POTS experience blood pooling, dizziness and brain fog. So all of these things interlink. Another one of the main features of all of these three conditions is fatigue.
Yes, so people generally, I feel, get confused between what actually is fatigue, because fatigue is different to tiredness. It can't be reduced by just, I'm just going to go have a nap, it's a one-time thing. So many people living with a chronic illness experience fatigue that lasts over a long period of time, and they just can't seem to shift it, or it might come in waves. And if it isn't managed well, it will affect daily life. So fatigue can be caused by POTS, as we've spoken. So it's due to the autonomic nervous system, which is the involuntary nervous system in the body. It's in overdrive and your body is working really, really hard, and it just absolutely knackers out your body. There's nothing else you can do. It just needs rest. It needs time to recover and recuperate and come back together. Other conditions such as chronic fatigue, hypermobility, Ehlers-Danlos loss, low blood pressure, they're all other conditions that in a similar way are likely to experience fatigue because their body just can't take it almost anymore. Medication can cause fatigue, so always read the side effects on the box of medication when you get it, because different medications have different side effects and fatigue might be one of them. And sleep problems. So people with POTS especially tend to have a poor quality of sleep. So this could obviously impact on daily life. Everything seems harder when you have a poor quality of sleep, or insomnia, things such as that.
Some of the symptoms, the sleep disorders include REM, sort of sleep cycle disorder, so that could be part of the sleep issues that people experience. So it's not just as simple as saying you don't have sleep, but it can be to do with the quality of sleep or the different phases of the sleep cycle that you have. Yeah,
so absolutely, it could be you don't get enough of that REM sleep that could cause you to feel fatigue. That, I mean, I don't personally know how you can fix that, but I'm sure there's someone out there that knows a lot more about sleep than I do.
I think it's more to do with the amount of time, and also if you were to take a nap, it's like trying to avoid having a 10-minute nap because each sleep cycle goes on for a certain length of time. So you're trying to I think you're trying to measure it in that way. But we're not sleep specialists, so we'll leave that to Jo, because I'm sure she has other resources on that. And did you have talking about emotions as well?
Yeah, so what effects does fatigue actually have on the body? So it can affect physical, emotional, behavioural and your cognitive systems. So it affects you physically, so you'll feel tired and wonder why sleep is both difficult but helpful but unhelpful in different ways. And like Amanda said, with the different sleep cycles and making sure you get it right, it can get quite confusing and really affect your energy levels, which could lead to engaging in less activity, which could over a longer period of time potentially lead to deconditioning or weakness, which could affect other aspects of conditions that we've spoken about. And then cognitive, so this could affect the way that you think. So fatigue links quite nicely with brain fog, which we discussed earlier on. So you might find it difficult to concentrate on tasks or feel like your brain is just overloaded, which I know I felt like in the last week or so. I don't know about you, Amanda, with all of this research and everything we've been doing. My brain's just felt overload and that I feel like I can't do anything anymore. It might also impact your memory, and it could also affect your work. Another aspect is fatigue could affect your behaviour. So it might long term lead to having to have time off sick or not being able to see friends and family, engage in activities you enjoy, and it might just affect your physical and mental health as you feel like you can't engage in the activities you deem as enjoyable or as fun as often. And then lastly, it can lead to you feeling emotionally drained. So how do you feel about it? It must be frustrating. You could be in an irritable or low mood, but it's important that you share these feelings with either a therapist or friends and family or someone around you that can listen and remind you that it's not forever. Fatigue can change day to day. As we've said before, there's no guarantees it will go away completely forever, but there's definitely ways that it can be managed.
And pacing is one
of them. You are correct.
Yeah. And again, Jo is very, very knowledgeable about pacing.
An expert in pacing.
An expert in that area. So we'll leave that to her to talk to you about at a different point. But the other thing, listening to you talking about sleep and its effects physically and also emotionally, makes me think about the effect of neurodivergence and the association between neurodivergence and hypermobility, which we have written a blog, which we'll also post, which we'll put a link in with the podcast, so you can read about that as well next time.
Yes, and that will be on Joe's website, I believe.
Yeah, so you'll be able to sort of link that back, because all of these things interlink. And although we've talked about a triad between MCAS, EDS and POTS, really we've actually got a fourth thing, which is looking at the neurodivergence, anxiety, depression, those sorts of things. So more of the cognitive side, more of the brain elements, that's the other side of these conditions that we need to really go into detail about. So you'll be able to read that next time, because you've listened to our voices enough. So that will be in a blog post.
Lovely.
Thank you very much.
Thank you for listening.